Okay, are you able to see the slide?
Yes, ma'am.
Yes, ma'am.
Okay, good. So in previous classes, you have been discussing about the role of insulin, right? From where it is released, what stimulates it from getting released, and how it acts on the various part of our body. No? So today we have a quick revision before going into today's subject matter, right? So we have seen that human pancreas, we have 1 to 2 million islet of Langerhans, and they contain 4 different type of cells. And beta cell is the one which produce insulin. And we have seen that glucose is the primary stimulus of insulin secretion, where glucose enter the beta cell by GLUT2 transporter, and it brings about sequence of changes inside the cell and thereby causing release of insulin, right? So we have seen that in previous classes how glucose helps in insulin secretion. Now this insulin which has been released from the beta cells, they are going to go on the target cell where they have over there. So they basically will cause activation of the target cell receptors or the insulin receptors, and thereby bring about the cellular effect. So what kind of cellular effects this insulin is bringing? So we have already studied that in last class how insulin, after they are been released, they go to their receptors in the particular target cell and they bring about glucose metabolism, fat metabolism, and protein metabolism. They also help in the growth and development of the individual, right? So we will see now how again insulin help in the carbohydrate metabolism, in the fat metabolism, insulin deficiency. So we will see subsequently how insulin deficiency will affect our body. So we had studied again this in last class how insulin works on the carbohydrate metabolism, right? So immediately after a high carbohydrate meal is taken, glucose that is absorbed into the blood, it causes rapid secretion of insulin, right? Now this insulin which has been released from the beta cells of the pancreas as a stimulant from glucose, this insulin will now go into the blood circulation and it will cause rapid uptake and use of glucose by almost all tissues of the body, but especially by the muscles, adipose tissues, and the liver. And it causes this glucose entry into the respective cells with the help of GLUT4 transporter, right? Now this insulin causes the entry of glucose into the muscle cells, right? Now this glucose, if there is excess glucose present in our body, then this excess glucose will be converted into glycogen, whether it is in the muscle, whether it is in the muscle or in the liver, right? So how this insulin promote liver uptake, storage, and uh, storage of glucose in the form of liver glycogen. So we have studied that in previous classes, so it's just a review of whatever we have studied. So first of all, insulin, it inactivates liver phosphorylase, which in the liver, in the muscles. So what insulin does is it will inactivate the liver phosphorylase. And we know that liver phosphorylase is an enzyme which is necessary for the breakdown of the glycogen to glucose. And insulin, it will inactivate this liver phosphorylase so that liver glycogen will not be split into glucose. First thing. And secondly, insulin cause enhance uptake of glucose from the blood by liver. How? By increasing the activity of the enzyme glucokinase, right? And when this enzyme glucokinase work on the glucose, it will cause phosphorylation of the glucose. Now this glucose which has been phosphorylated, they cannot go back to the cell membrane. So this is how the glucose will be trapped inside the cell. So it will increase the activity of the enzyme glucokinase and bring about phosphorylation of the glucose. It prevents the glucose from getting back or getting out of the cell membrane. Insulin also increases the activity of the glycogen synthase, which promotes glycogen synthesis. So insulin, it is working at the three levels. It is the glycogen which is already present in the muscle or the liver to be broken down phosphorylase. Secondly, it will enhance the uptake of glucose by increasing the activity of the enzyme glucokinase. Glucose will be phosphorylated and now they will not be able to get circulation. And thirdly, it stimulate the glycogen synthesis, thereby it will promote the formation of the glycogen, right? So you can see in this picture very clearly that it acts that at three levels. Firstly, it will help in the conversion of the glucose to glucose 6-phosphate by activating the enzyme glucokinase. So when the glucokinase enzyme is activated, it will cause phosphorylation of the glucose to 6-phosphate. Now this glucose 6-phosphate will not be able to get back into the circulation. And secondly, it will stimulate the glycogen synthesis so that whatever extra glucose is present in our body, they will be converted into glycogen, right? And thirdly, it will inhibit liver phosphorylase so that whatever glycogen is already stored over there, they will not be broken down or split into glucose. So at this three level, insulin is working. It will stimulate glucokinase, it will stimulate glycogen synthase, and it will inhibit liver phosphorylase so that glycogen will not be broken down into glucose. So in this way, insulin helps to uptake glucose by the cells, and whatever abundant glucose is present in our body, that abundant glucose will be stored in the form of glycogen. And in between meals, when food is not available, right, the decreasing blood glucose, right? So what happens in between the meals when food is not available, the blood glucose in our body tends to decrease. Now when the blood glucose decrease in our body, then it will cause the pancreas to decrease insulin secretion, right? And at the same time, it will cause the liver glycogen to be split back into glucose. And finally, there will be glucose into the circulation in between the meals. So this is how glucose metabolism or the carbohydrate metabolism is carried out by insulin. When there is glucose excess, the glucose will be either utilized by the muscles and the liver, right? And when the glucose is in excess, then that excess glucose will be stored in the form of glycogen. And in between meals, when there is decreased glucose level in our body, then there will be decreased insulin secretion from the pancreas, and now this liver glycogen will be split back in. Glucose will be now available in our body for the energy production in between the meal time, right? So that was about the effect of insulin in glucose metabolism or in carbohydrate metabolism, right? Now, what is the consequences of insulin deficiency in glucose metabolism? So when there is decreased insulin in our body because of some cause, like because of there can be destruction of the beta cells, right, which causes decrease in insulin secretion in for a chronic time, for a longer duration of time. So at that time, when there is insulin deficiency, then what will happen to the carbohydrate or the glucose metabolism? So whatever scenario you saw in the previous slide, how glucose was being utilized by the muscles and the liver, and it was being stored in the form of glycogen when there was excess. But in case of insulin deficiency, now what will happen? The lack of insulin, right, decreases the efficiency of the peripheral glucose utilization. As there is no insulin, what will happen? There will be no utilization of the glucose because GLUT4 will not be embedded in the cell membrane, and because of that, cell will not be able to take up the glucose. So there will be decreased utilization of the glucose by the cells of our body. And because of that, it will raise the plasma glucose from 200 to 300 milligram per 100 ml. It can even go higher in a longer duration of time, right? So there will be increased glucose concentration in the blood, right? Because of the decreased utilization of the glucose. Now, the very high level of blood glucose can cause severe cell dehydration throughout the body. Now, why this dehydration occurs throughout the body when there is increased glucose level in our body? This occurs partly because glucose does not diffuse easily through the pore of the cell membrane, and the glucose which is outside the cell, it will cause increased osmotic pressure in the extracellular fluid and causes osmotic transfer of water out of the cell, causing dehydration, right? So because of insulin deficiency, what is happening? There is no utilization of the glucose, or there is decreased utilization of the peripheral glucose, and because of that there will be rising level of plasma glucose from 200 to 300 milligram per 100 ml. Now this high level of blood glucose, it will cause severe cell throughout the body, and this occurs because glucose they do not go into the cell membrane, and indeed this extra glucose or this glucose will create osmotic pressure in the extracellular fluid, and this osmotic pressure will bring about the osmotic diuresis. That means there will be that it will cause the osmotic transfer of water out of the cell, causing dehydration of the cell. So because of that, body of the individual who is having the insulin deficiency. And thirdly, the high blood glucose causes more glucose to filter into the renal tubules and leading to further osmotic diuresis. So this high blood glucose, it is entering into the renal tubules, right? And as it enters the renal tubules, then what will happen? There will be increased osmotic effect of glucose in the renal tubules, and thereby there will be decreased tubular reabsorption of the fluid by the tubular cells, and because of that there will be increased water or increased osmotic diuresis taking place, and as a result the overall effect is massive fluid in the urine, which is called as the polyuria. And as there is increased urination, there will be and also the cells are been continuously having this osmotic diuresis, it will lead to dehydration of the person, and because of this continuous dehydration, it will finally stimulate the thirst center in the hypothalamus, and that will bring about more drinking of water, and that is called as the polydipsia. So these three are some of the features of the insulin deficiency seen because of insulin deficiency. Okay, so what is the effect of insulin deficiency in the carbohydrate metabolism? Because of decreased insulin in our body, and this decreased insulin in our body can occur because of the destruction of the beta cells of the pancreas, leading to decrease in insulin. And because of decrease or lack of insulin in our body, it will cause decrease in efficiency of the peripheral glucose utilization, and thereby it will bring about increased glucose concentration in our body. Now this because of the osmotic pressure created by this extracellular fluid, which causes osmotic transfer of water out of the cells, causing dehydration. And this blood glucose now is going to filter into the renal tubules, and as it passes through the renal tubules, and in the renal tubules also it will create osmotic effect of glucose in the renal tubules, and thereby it will greatly decrease the tubular reabsorption of the fluid, or you can say there will be osmotic diuresis, and overall effect of this will be increased loss of fluid in the urine, which is called as the polyuria. And also because of continuous loss of water from the body, person will have dehydration, and as the person is getting dehydrated, then it will stimulate the thirst center present in the hypothalamus, which will cause which will stimulate thirst, and the person will be drinking more water, which is called as the polydipsia. So polyuria, dehydration, polydipsia, it is seen because of insulin deficiency and because of effect of insulin deficiency in the glucose metabolism. Now now you can see that there is high concentration of the glucose in the person's body, right? Now this chronic high glucose concentration in the body of a person will eventually cause tissue injury, okay? So multiple tissues throughout the body begins to function abnormally, and they undergo structural changes that result in inadequate blood supplies to the tissue, okay? So because of chronic high glucose concentration in the body, there will be structural changes taking place in the blood vessels, in the cells, and that will lead to the inadequate blood supplies to the tissue. And because of this, you can see various complications because of high blood glucose concentration in the body. And one of the most important complications, or one of the most important changes that can occur in a person is peripheral neuropathy. Now, what do you mean by neuropathy? Neuropathy, it can occur as a result of metabolic, oxidative, or immune-related changes to neurons or swan cells. Okay, so swan cells, it is not been able to function properly in case of excessive hyperglycemic state. So as a result, what will happen? These swan cells, which are responsible for myelination, right? So swan cells, they are the supportive cells involved in myelination. Now, when these swan cells, they cannot function properly, they will start to accumulate sorbitol in response to hyperglycemia. Okay, are you understanding? There is chronic high blood glucose concentration, right? And because of chronic high blood glucose concentration, there will be structural changes taking place, and that will lead to inadequate blood supply to the tissues. And the first and foremost thing which you can see is neuropathy. Neuropathy, it occurs because of the some of damage to the neurons or the swan cells in the neurons. Swan cells, they are the supportive cells involved in the myelination, right? And when there is hyperglycemic state, then this swan cell will stimulate, or it will start to accumulate sorbitol, and sorbitol, it will cause the sodium potassium pump and other pump to function abnormally. And as the sorbitol is getting accumulated, then the person will have the sensory loss. They will feel the paresthesia. Paresthesia is like kind of burning sensation, and even pain as a result of neurologic damage. Okay, so as there is damage to the uh, neurons because of the accumulation of sorbitol, there will be sensory loss, there will be paresthesia, that is a burning sensation, and there will be also, and the person will also feel some kind of pain as a result of neurologic damage. And this sensory loss is more apparent in the extremities, particularly in the lower portion of the legs and feet. Okay, so sensory loss will be more apparent in extremities, particularly in the lower portion of the legs and feet. Now, when there is sensory loss in the lower portion of the legs and feet, then what will happen is the patient or the person will become unaware of the poorly fitting shoes, and they are very much prone to injuries. Okay, as there is neuropathy, as there is sensory loss, they will not feel the they will be unaware of the poorly fitting shoes, or they will be unaware of some kind of injuries, and they ultimately can cause food ulceration. So in people who have high blood glucose concentration, food ulceration can become a very serious threat because of the sensory loss or because of the peripheral neuropathy, right? Likewise, a person can have retinopathy. Retinopathy is again some kind of abnormalities seen in the retina of the eyes. Now, why this retinopathy occurs? Because of the hyperglycemic state, right? This person is having a very high blood glucose concentration because of insulin deficiency. Now, because of this hyperglycemic state, it results in the endothelial cell dysfunction in the retinal cells. Now, as this endothelial cell is getting dysfunctional, then there will be decreased nitric oxide, and this decrease in nitric oxide will bring about increased vascular resistance and finally cell death, and it will lead to retinopathy. Likewise, there can be nephropathy. Nephropathy is also because of hyperglycemic state only. Because of hyperglycemia, there will be structural changes taking place in the capillary, in the glomerular capillary basement membrane, right? And because of the structural changes in the glomerular capillary basement membrane, this glomerular capillary basement membrane, they seem to be thickened and the lumens are narrowed, and that will lead to nephropathy. And also you can see hypertension. Hypertension is basically secondary to nephropathy, where there is a poor renal filtration that will lead to activation of the renin-angiotensin system and finally inducing hypertension. So you can see because of the chronic high glucose concentration, there can be various changes occurring in our body. Okay, and it occurs because of the structural changes because of increased glucose concentration. There can be peripheral neuropathy, there can be retinopathy. Peripheral neuropathy is a damage to the neurons. Retinopathy is a damage to the retinal cells. Nephropathy is the damage to the glomerular capillary basement membrane, and hypertension because of the it is secondary to the nephropathy, right? So these all changes can occur because of the high blood glucose concentration secondary to the insulin deficiency. So insulin deficiency can cause increased high blood glucose concentration, and high blood glucose concentration is definitely not good for our body because it brings about the structural changes and bringing about different kind of diseased state in our body. Now, the question is, does brain require insulin for glucose utilization? What do you think? Does brain require insulin for glucose utilization? Can anyone answer?
No, ma'am.
Are you sure? Why not? Why do you think that brain doesn't require insulin for glucose utilization?
Brain is a very important organ, so it does not rely on the insulin utilization.
Because? Anyway, yes, you are right. Brain does not require insulin for glucose utilization because in the brain it does not contain the GLUT4 receptors. It has GLUT1, which does not require the insulin for the entry of glucose into the brain cells, right? So brain generally they do not require insulin for glucose utilization because the glucose transporter is different in the brain, and it is not under the influence of insulin, right? But there are some areas, there is one particular area in the brain which require insulin for the glucose utilization, and that area is ventromedial nucleus. Okay, so right now there are many nucleus in the hypothalamus. I think you know it, but here the important two nucleus which I want to focus is ventromedial nucleus and the lateral nucleus. Okay, So ventromedial nucleus, it is the satiety center, and its destruction results in obesity and savage behavior. And lateral nucleus, it is responsible for eating. It is also called as the feeding center. So lateral nucleus, it is also called as the feeding center because it induces eating habit. Okay. Now, what is the communication, or what is the relation between ventromedial nucleus and the lateral nucleus? Is that ventromedial nucleus, it is a satiety center. Satiety center means you get a feeling of satiated, or you get a feeling of fullness, right? Now this ventromedial nucleus, it requires insulin for the glucose entry into the ventromedial nucleus. And when there is insulin, then the glucose will enter into the ventromedial nucleus, right? And this satiety center or the ventromedial nucleus, they will get satiated or they will get full. Now this ventromedial nucleus, when they are satiated, then they will inhibit the lateral nucleus. Lateral nucleus, as I told you, it is the feeding center, right? So when the VMN, satiated center, they get stimulated or they get full, then they will inhibit the lateral nucleus. Thereby, it will inhibit feeding, right? So when we eat, then we have a lot of insulin production, and because of this, with the help of insulin, the glucose will enter into the ventromedial nucleus of the thalamus, hypothalamus, and when this satiety center gets satiated, then it will inhibit the lateral nucleus, so that it will inhibit the eating process, right? But when there is insulin deficiency, then what will happen? When there is insulin deficiency, now what will happen? The ventromedial nucleus, they will not be able to utilize the glucose, or there will be very low or no utilization of the glucose by the glucostat cells of the ventromedial nucleus, or the satiety center, right? Now, when there is no utilization of the glucose by the satiety center, then there will be no inhibition of the lateral nucleus or the feeding center, which results in continuous hunger in these people. So, because of that, they will be continuously feeling hungry and they will be continuously having food, and that is called as polyphagia. Okay, so the person who is having insulin deficiency, they also tend to eat more, or they will be always hungry, and it is because ventromedial nucleus, they will not get the they will not be able to utilize the glucose in the absence of insulin, and because of that, ventromedial nucleus or the satiety center will not be satiated. As a result, they will not inhibit the lateral nucleus, which is the feeding center, and it will result in the hunger, continuous hunger, and which is called as the polyphagia, where the person is continuously having food. Okay, so in a person who is having insulin deficiency, so you saw that they will have polyuria, they will have dehydration, they will have polydipsia, and they will have polyphagia. Now let us talk about the effect of insulin on fat metabolism. Like in fat metabolism also you have already talked about what will happen to the fat, right? So insulin basically increases the utilization of glucose by most of the body tissue. So it automatically decreases the utilization of the fat. Thus, insulin is called as the fat sparer because it tries not to utilize fat as much as where glucose is present, right? So it is causing continuous utilization of glucose and decreasing the utilization of fat. That is why it is called as the fat sparer, right? And it will now when the quantity of glucose entering the liver cell is more that can be stored as glycogen, insulin promotes the conversion of this or conversion of all this excess glucose into the fatty acids. Okay, so first of all, I'm really sorry for the disruption. Can you hear me now?
Yes, ma'am.
Okay. Are you able to see the slide? Yes?
No, ma'am.
Now? Yes or no?
No, ma'am.
Okay, now can you see? Yes or no?
No, ma'am.
No.
Yes, ma'am.
Anyone can see or
Yes, ma'am. Yes, ma'am.
yes? Okay. Okay, good. Okay, so we had talked about the what will happen if there is insulin deficiency, right? So when there is a and use of probiotic energy are greatly enhanced because we saw that insulin was fat sparer, right? But in case of insulin deficiency, now there will be starting of fat breakdown, and there will be more importantly, there will be activation of this hormone sensitive lipase, and this hormone sensitive lipase is responsible of the stored triglyceride in the fat. Okay, so initially fat insulin was causing sparing, right? Fat sparer, but when there is insulin deficiency, then there will be activation of hormones stored triglyceride. So now this stored triglyceride will be acid. You can say two pathways. Either liver will promote the conversion of some of the fatty acid into phospholipid and cholesterol, or some of the fatty acid will be transported into mitochondria by carnitine transport system. So there can be two things. Either there will be conversion of fatty acid into phospholipid and cholesterol, or there will be fatty acid transported into mitochondria by carnitine transport system. So we will see one by one. So liver promotes the conversion of some of the fatty acid into phospholipid and cholesterol. So breakdown of triglyceride into fatty acid, and this fatty acid is now converted into phospholipid and cholesterol. Now these two substances along with the excess triglyceride which is formed at the same time in the liver, then they are discharged in the blood. Okay, so this causes lipoprotein to be increased in the blood as much as 3 folds, and this condition is called as dyslipidemia. So there is dyslipidemia means there is increase, or there is, it is characterized by the hypertriglyceridemia where there is large triglyceride reach very low density lipoprotein, right? Now these large triglycerides, they will be broken down or they will be digested efficiently and release low density lipoproteins. Now these low density lipoproteins, they are atherogenic. That means it will induce atherosclerosis. So that is how in insulin deficiency, patient can have or they are more prone to atherosclerosis because of increased fat breakdown or increased triglyceride breakdown, leading to formation of fatty acid. Fatty acid getting converted into phospholipid and cholesterol, and this phospholipid and cholesterol and triglyceride, they will be discharged into the blood. They increase lipoprotein level to be increased in the blood circulation. This is called as the dyslipidemia. High density lipoprotein, they will be digested efficiently and they might release low density lipoprotein. And this low density lipoprotein or LDL, they are atherogenic and thereby they can induce atherosclerosis. And the second pathway was some of the fatty acid, if you remember, after the breakdown of triglyceride into fatty acid. Now this some of the fatty acids, they can go to mitochondria by carnitine transport system. In the mitochondria, what happens? There will be beta oxidation of the fatty acid and it will release increased acetyl-CoA. Okay. Now last part of acetyl-CoA, it will be condensed to form acetoacetic acid. Now some of the acetoacetic acid is converted into beta hydroxybutyric acid and acetone. Okay. Now these two substances, that is beta hydroxybutyric acid and acetone, along with the acetoacetic acid, is called as the ketone bodies, and the condition is called as the ketosis. Okay. So in the absence of the insulin, what is happening? There will be breakdown of triglyceride from the fat cells by activating the enzyme hormone sensitive lipase. So triglyceride will be released into the circulation and that triglyceride will be broken down into fatty acid. This fatty acid will be transported to mitochondria. In the mitochondria, there will be beta oxidation of the fatty acid, releasing increased acetyl-CoA, and this acetyl-CoA, it will be condensed to form the acetoacetic acid, and this acetoacetic acid will be further converted into beta hydroxybutyric acid and acetone. Okay, so this beta hydroxybutyric acid, acetone and acetoacetic acid together, they are called as the ketone bodies. So in the absence of the insulin, person is susceptible to more of ketone bodies, and the condition is the ketosis. And because of increased formation of these ketone bodies, the patient will develop severe metabolic from the excess keto acids, which is association with the dehydration caused by the osmotic diuresis, severe acidosis, and person can go into diabetic coma. Okay, so increased ketone body formation will lead to metabolic acidosis, and metabolic acidosis along with the increased dehydration throughout the body can cause a person to go into diabetic coma. And one of the particular feature of the metabolic acidosis is the person will have a very rapid and deep breathing because it tries to increase expiration of the carbon dioxide, thereby trying to buffer the acidosis environment in the body. Okay, insulin in the fat metabolism and effect of insulin on protein metabolism. You already know it is the anabolic hormone. It tries to stimulate the amino acid into the cell. It brings about translation and transcription of mRNA, thereby forming new proteins. It inhibits catabolism of these proteins. It will depress the. You can say that insulin promotes protein formation, and insulin is an anabolic hormone. It tries to promote protein formation and prevents the degradation of proteins. Deficient, then what will happen to the protein metabolism? So you can just guess it. When there is insulin deficiency, protein depletion, because when the insulin was present, insulin was trying to new proteins, it was trying to inhibit protein breakdown, it was trying to form new proteins, right? But in case of insulin deficiency, there will be protein depletion in the cells. Then it will increase. Remember, because of insulin, the catabolism of protein was inhibited. But when insulin is not present, there will be catabolism of protein. There will be stoppage of protein synthesis, and high quantities of amino acid are dumped into plasma. Okay, so there is catabolism of protein. There is formation of protein synthesis is being stopped, and because of that, there will be catabolism of protein, and these amino acids will be dumped into the plasma. They act as a substrate for gluconeogenesis. Okay, and because continuous of the protein, a person may suffer rapid weight loss and asthenia. Asthenia is feeling of weakness. So, person who is having increase and who is having insulin deficiency, and because of that, person will have rapid weight loss and weakness. So, about consequences of insulin deficiency. So you saw what happens in glucose metabolism. In insulin deficiency, they will lead to nephropathy, retinopathy, all those things, right? And because of the deficiency of insulin in fat metabolism, you saw that person can have dyslipidemia. At the same time, they can have this ketoacidosis. There will be formation of ketone bodies, which is called as the ketoacidosis. So there will be metabolic acidosis environment in the person's body. And talking about the protein metabolism, there will be increased protein breakdown of the in the body, and because of that, person have decrease of weight loss, or they tend to have weight loss, and they tend to have asthenia. So that was about the decrease in the insulin in a body. Now, what will happen when there is insulin excess in our body? So, excess insulin occasionally occurs from an adenoma of an islet of Langerhans. About 10 to 15% of these adenomas are malignant, and occasionally metastasis from the islet of Langerhans spread throughout the body, causing tremendous production of insulin. So, main cause of insulin production is because of adenomas of the islet of Langerhans producing more insulin. Also, in patients who are diabetes, they tend to administer too much insulin by themselves, right? And which can lead to a syndrome which is called as the insulin shock. So increased insulin can occur because of the insulin secreting tumors or in patients with who administer too much insulin. Now, what will happen when there is too much insulin in the person's body? So, as you know, insulin causes maximum utilization of glucose, right? So, when there is maximum insulin, there will be maximum utilization of the glucose by the cells. And because of that, blood glucose level can fall in the range of 50 to 70 milligram per 100 ml. And when the blood glucose level falls to this level, some people, they show various form of hallucination, right? And some patients, they may experience extreme nervousness, trembles all over, and breaks out in a sweat. Okay, but as there is increased insulin and the blood glucose level falls still further, right, 20 to 50 milligram per 100 ml, then at that time the person can feel clonic seizures, and there can be loss of consciousness. And as the glucose level falls still lower, the seizures and only a state of coma remains. So when there is increased insulin production in our body, then it will cause maximum utilization of glucose, thereby causing blood glucose level to fall down. And when blood glucose fall down at the level below 50 to 70, then person can show hallucination, nervousness, and they can break out in sweat. And if blood glucose level falls below 20 to 50 mg per 100 ml, then they can show clonic seizures and loss of consciousness. And when it still further declines, then the seizures will stop and there will be state of coma. So that was about the insulin excess. Okay. In the next class, we will be talking about the diabetic mellitus type 1 and type 2 in detail. And at that time, I think you will understand better what will happen if there is insulin deficiency, what will happen if there is insulin resistance. Okay. So about diabetic mellitus, we'll be studying in the next class. I hope you have understood today's class to some extent. And if you have any doubt, you can please message me. All right. Thank you, everyone. Are you there, all of you?
Yes, ma'am.
Yes,
Yes,
ma'am.
ma'am.
So you have understood something? or nothing?
Yes, ma'am. Something.
Something. Okay, please read. You're gonna have exam in the next week. We have all your books in front of you. Please read properly and write an exam also. All right. If you have any doubt, you can just message me. Okay. Bye.